Here we go.
And this is going to be my first time experiencing not having control.
And Laureen, it's not that she's a control freak, but
No.
Yes,
No,
I am.
you just tell me when to click to change, okay, Laureen?
All right. Okay, so this question was I was reviewing Laureen's Blitz video yesterday on radiology, and I wanted to clear up something for me. She stated supervision and administration. This is so funny. I didn't pick up the first time that she was talking about me. I thought she was talking about another instructor. And I'm like, yeah, she got it wrong. It's supervision and interpretation. So if I said supervision and administration, I meant to say supervision and interpretation. So actually, if you can just click on the answer sheet.
I'll move it over now.
This is something, we answered this, and I went and searched our website, and I found a video answer that we had done on a previous webinar, but it was from 2012. Even though the answer is still the same, I thought it was worth answering again, because this is a topic that really seems to stump people in the radiology section of CPC exams, how to understand supervision and interpretation. What does that mean? So just keep scrolling down past the green, and I want them to see the little clip of my CPT manual. There you go.
Okay.
So right there, for those in the replay club, I gave you the link to the previous answer that we did on this, and right below it, this is how I teach it in the course. Supervision and interpretation, when you see that, you want to think this is part of a two-code story, okay? So if you look at these codes, and I just grabbed a little, quick shot of my CPT manual, and you'll see right below 20225, in the parenthetical note, it says for radiologic supervision and interpretation, C77002. So these two codes in the 20,000 series are in the surgery section of the musculoskeletal system. So they're surgery codes. And then there are corresponding radiology codes that go with this. It's part of a two-part story. And the history on this is way back in the day, they only had one code to represent one of these types of procedures. And they were finding that, because the intention was one guy was doing it, or one woman, but sometimes they actually would bring a surgeon in to do the surgery piece, and then the radiologist would do the radiology piece, and they couldn't figure out mathematically how to divide the codes, because in some cases the surgery piece was a lot more of the pie than the radiology, and vice versa. So they just said, you know what, let's just have separate codes. So you use the surgery codes for that piece of the story, and you use the radiology codes for that piece of the story. So if the physician that you're coding for did both pieces, then you code both codes. If they only did one piece, you just code the one piece. So all that phrase, supervision and interpretation, is a heads up that it's part of that two-code story. I think did I do the guidelines a little bit below that?
That's the end. Right
that
there.
Is the end.
Okay.
Okay. So yeah, there's a little more in purple there. So for some reason, this gets confused with Modifier 26 for the professional component. And I hate to even say it here because I don't want you to think it has anything to do with it, but because it always gets confused, I just want you to make a note somewhere in your manual, the radiology guidelines perhaps, where they talk about supervision and interpretation, that it has absolutely nothing to do with Modifier 26, which means professional component, interpretation, and report is normally how people will phrase it. The only thing they have in common is they share that one word, interpretation, but they don't have, they're two different concepts in the radiology section. So with Modifier 26, you're just trying, if you append that modifier, you're telling the story to the payer that your physician should only get paid for the professional piece. In other words, they're not a freestanding radiology clinic that should also get paid for the X-ray equipment, the rad tech, so the technical piece. Okay, two different pieces. So S and I has to do with being part of a two-code story, and 26 has to do with professional component only or not. Okay, so hopefully that will help with that. And if I said supervision and administration, then that was a slip of the tongue. I meant interpretation.
Good job. That and reiterating, Laureen has a CEU package for modifiers that has the modifier grid in it. Amazing tool. When you have the concept of does it take away money or does it add money or does it stay the same, that kind of helps you understand that as well, I think.
All about the money.
Yep, all about the money.